Hi everyone, welcome back to my YouTube channel, and today we are going to talk about hemorrhage. So let's start our topic with introduction. Hemorrhage refers to the escape of blood from blood vessels due to rupture or injury. It can occur internally within tissue or organs, or it can occur externally through body openings or wounds. The severity of hemorrhage ranges from minor bleeding to life-threatening blood loss. Definition of hemorrhage. Medically, hemorrhage is defined as the loss of blood from circulatory system due to damage to blood vessels. It may be acute or chronic depending on the cause and duration. Types of hemorrhage. First type is arterial hemorrhage, that is bright red blood spurting in the rhythm with the pulse. Second type is venous hemorrhage, that is when dark red blood flows steadily. Third is capillary hemorrhage, that is when there is slow oozing of blood from the small vessels. Fourth type of hemorrhage is external hemorrhage, that is when blood loss visible outside the body. And fifth type is internal hemorrhage, that is when blood loss is within the tissue or cavities and not immediately visible. Causes of hemorrhage. There may be trauma or injury to blood vessels. Medical conditions such as hypertension, aneurysms, or clotting disorders can cause hemorrhage. Surgical complications, gastrointestinal ulcers or varices can also cause hemorrhage. And obstetric causes like postpartum hemorrhage can also happen. Clinical features. First is visible bleeding in case of external hemorrhage, and then there is signs of shock, pallor, rapid pulse, low blood pressure because of blood loss, and there may be pain or swelling in case of internal bleeding. And dizziness, fainting, or confusion is also present with hemorrhage due to blood loss. Diagnosis of hemorrhage. Clinical examination and history is taken first. Then imaging can be done for internal hemorrhage, like CT can be done and ultrasound can be done. Then laboratory tests can be done for hemoglobin, hematocrit, and coagulation profile. Complications of hemorrhage. First, it can cause hypovolemic shock if the hemorrhage is too much. It can cause organ failure due to reduced oxygen blood supply. It can cause death if untreated and it is very severe. Management of hemorrhage. First we can do is first aid, that is to apply pressure to external bleeding sites to prevent further bleeding. Second we can do is medical treatment, in which we give IV fluid, blood transfusions can be done, and oxygen therapy is given. Third we can do is surgical intervention in which we do repair of damaged vessels and also removal of bleeding sources. Fourth, we can give medications that include hemostatic agents and antifibrinolytics. Prevention. Prevention of hemorrhage can be done by control of hypertension and vascular diseases, especially in case of internal hemorrhage. Safe surgical techniques should be used to prevent the postpartum hemorrhage or postoperative hemorrhage. We should use of protective equipment to avoid trauma, and early treatment of ulcer and varices should be done to provide further or more hemorrhage. Conclusion of this lecture video. Hemorrhage is a critical medical condition that requires a prompt recognition and management. Understanding its types, causes, and treatment strategies is essential for saving lives and preventing complications. And this was all about hemorrhage. Hopefully you like the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.